Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allan, and Board of Health Co-Director of Prevention and Wellness, Ramona Brazil. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Good afternoon. As always, I want to start by thanking Board of Health Commissioner Terry Allan for his tireless work and for leading a great staff that's been keeping us healthy. Now, let's talk about a major problem facing the county. Lack of access to the internet can impact our residents in really negative ways. For example, good health often depends on internet access. Medical records are increasingly available primarily online. Easy access to health test results is incredibly important. Many testing sites require signing up online in advance. And as Metro just announced, telemedicine will become more and more prominent. Kids need the internet to do homework, and a job seeker needs it to apply for jobs online. I know I bring this up a lot, but until you're without internet access, it can be hard to understand just how big of an impact this has on people's day-to-day lives. 19% of county residents don't have consistent access to the internet. That's roughly 228,000 people, one of the worst connection rates in the country. We cannot thrive as a region if our residents don't have internet access. So we've been working for a few years to get people connected. I want to update you on a few recent projects. In July of this year, our Office of Innovation and Performance, which has been leading this effort, released a request for proposals to solicit solutions to expand affordable, high-speed broadband services to those people who are lacking internet access. This could be in the form of new products and pricing or new service options with discounted rates. It could be free Wi-Fi that residents can reach from their homes. The possibilities are many. The goal of this is to develop a more long-term solution for quickly and efficiently getting a large number of residents connected. In response to the RFP, we received 9 proposals that we're currently in the process of evaluating. We stand to find good partnerships as we look to deploy innovative resources into the community. We're also waiting for further guidance from the U.S. Department of Treasury for how we can use our ARPA funding for digital inclusion projects. We should find out more about that this fall. As we review proposals, we're continuing to get people connected in the meantime. You might remember at my State of the County earlier this year, I announced our Neighborhood Surge project, which has the goal of surging county and partner resources into a community that's been historically disinvested. Our pilot project is with the Central neighborhood. Last month, we went out into the neighborhood to hear about the ways the county could help achieve the goals that they have set for themselves and their community. Over 100 residents joined us. We know that over half of the households in Central don't have consistent internet access, which is very high. So at the beginning of this month, we signed a contract with nonprofit Digital C to provide affordable, in-home, high-speed broadband services to residents in the Central neighborhood. We're putting $330,000 into this work, with additional investments from Digital C and the Cleveland Public Library, bringing the total to over $600,000. This partnership will build out wireless internet service for approximately 70% of Central, and it'll provide equipment for roughly 500 households. Installation work is expected to begin in mid-November, with services to be offered to the residents at the beginning of the new year. Residents in the Central neighborhood who are interested in signing up for access can call this number, 216-777-3859. As of today, we have already 130 families on the waiting list for this service. This project should have significant benefits for the residents. And there's one more important thing I want to talk about related to our digital divide work. If you do have internet access, is your connection reliable? Is your internet fast? Are you able to do everything you want on the internet when you want to do it? While we must get the unconnected connected, we also want to help residents improve their current internet service. So we're asking all residents to complete our internet speed test and survey. We're doing this in collaboration with the Measurement Lab, Marconi Society, and XLab at Penn State University. With just one computer click, you can perform a speed test in your home that takes less than a minute to run. You can also answer a few questions about your internet service provider. How much do you pay for internet monthly? How satisfied are you with your services? And you can talk about any other issues you regularly experience with your service. By completing this quick test and survey, you're providing incredibly valuable information about where internet shortcomings exist. This will help us continue targeting our work to the highest areas of need. So far, we've had nearly 550 residents complete the speed test and survey, but we're looking for more. The more information we can get, the more accurate our data will be, and the better we'll be able to serve you. You can visit Cuyahoga.mappingbroadband.com to complete the test. It's listed on the screen in front of you. Please take this short test so that we can help improve your service. Thank you. And now I'll turn it over to Terry Allan.
Thank you very much, Armond, and for your public health leadership over the last 19 going on 20 months, soon to be pandemic. And it's very much appreciated, and the opportunity to work with you and your support for public health. So at our last briefing together on September 15th, the Cuyahoga County Board of Health joined Executive Budish in issuing a countywide indoor masking advisory to blunt the rising surge of COVID-19 cases in Greater Cleveland driven by the Delta variant. This advisory was particularly important for the school setting, where cases among students and faculty have been trending up. These evidence-based public health recommendations follow CDC guidance for an area with substantial or high community spread of COVID-19. Other respiratory viruses which impact children like RSV and parainfluenza, which are usually not seen until late in the fall, are already circulating in our community, in addition to COVID and the specter of flu, which is upon us in terms of flu season emerging. Our current trajectory of cases places us at over 4 times the threshold of identified by CDC as high transmission. Now, the current week's data have been better, and that's very encouraging, but it is not a trend yet that we feel comfortable saying we're headed toward. So we'll keep watching the data to see if things have leveled off or will improve. But right now, we need to be vigilant and continue to be very vigilant with where we stand, because case transmission is very high. All 88 counties in Ohio remain at high transmission. Area hospitals, which when we talked last were at 80% of their care capacity, are now at 84% of their care capacity to treat patients who may present with illness. And this is just as flu season is starting, and their admissions are predicted to increase as they do every flu season. Hospitals are now having to triage patients based on the level of need, and they're delaying certain procedures. They're also reducing visitation in an attempt to slow down this very concerning surge. We've seen significant increases in COVID-19 cases from exposures in the school environment as well since school began. These cases require isolation and quarantine of students and staff to reduce risk. This interrupts the in-person education that we know children need. So we've heard from the governor, we've heard from Dr. Vanderhoff, the state medical director, and the data is clear. Masking in schools keeps kids in school and learning. Given these disturbing trends, the children's hospitals across Ohio urged schools to adopt universal indoor masking requirements to protect children and families. We don't want kids to end up in the hospital. And God forbid, we don't want any children to die from COVID. If we want to keep our schools and workplaces open and prevent more of our residents from getting COVID, we must meet the imperative to vaccinate more people now and embrace universal masking in indoor environments when around others. If you're unmasked and you're unvaccinated indoors and around others, your risk for contracting COVID is very high and will remain so. In fact, Dr. Vanderhoff said it's not if, it's when you'll get COVID, given the surge of the very transmissible Delta variant. So moving to the vaccine front, about 55% of all residents have been fully vaccinated. We also very closely track our equity data. Nearly 34% of African Americans, 44% of our Hispanic Latinx population have been fully vaccinated. So we need to keep and continue to keep our work central in our community clinics where we're providing first and second doses to serve the areas that have lower vaccination rates in our areas where we know they're particularly vulnerable for transmission. And overall, if we look at our data, our countywide data and our specific equity data, it shows that many of us still remain unvaccinated and vulnerable to contracting and spreading the Delta variant in the community. So we continue to urge everyone over age 12 to get vaccinated as soon as they can. Vaccinations are readily available, as we all know, from health departments, pharmacies, hospitals, and community health centers. Lots of places to get vaccine and lots of vaccine available. And please remember that almost all the hospitalizations, fatalities are associated with unvaccinated people. Vaccination keeps you out of the hospital and it protects you. We share a community responsibility to protect and save as many lives as we can from the pain and suffering caused by COVID-19. We also need to protect our hospitals from being overrun by the pandemic and unable to treat those who need care. Sadly, as expected, we've seen an increase in deaths this last week as hospitalizations and deaths follow surges in cases. The mask advisory that we released 2 weeks ago remains in effect as we continue to urge all businesses, nonprofits, cities, villages, and townships to require masks in their buildings and promote vaccination. On the vaccine front, we continue to collaborate with local foundation community members, other government agencies, nonprofits, community health centers, hospitals, and grassroots agencies to spread the word on the many locations where vaccine is available. Vaccination is by far the leading public health prevention strategy that can slow and ultimately end the current pandemic. Vaccines continue to be readily available through many providers throughout the county. You can go to the gettheshot.coronavirus.ohio.gov website or by calling 211. The Cuyahoga County Board of Health is offering $100 cash cards for those who receive a first dose at one of our upcoming Board of Health community clinics. And this is for those that specifically receive their first dose. These cards are only for first dose clients and not for second dose or booster clients. The location, dates, and times for these clinics are available at our website. If you go to www.ccbh.net, as you'll see behind me, and choose COVID-19 information from the drop-down menu, there you'll find the COVID-19 clinic schedule. And our first dose clinics are listed under local clinics. So please sign up for one of our local clinics if you haven't got your vaccine yet to get that first dose and get your $100 cash card by also calling 211 or going to the Get the Shot website at the state. So recently, federal authorities have made additional recommendations on COVID-19 vaccination for those at high risk for exposure and complications. You've heard us talk about people with immune system problems that are moderate or severe. They're eligible to receive an additional dose of mRNA vaccine after the initial 2 doses, and that is for Pfizer and Moderna. This group is about 3% of the population, and many of those folks have been going to their healthcare providers and seeking that additional dose. Given the particular risk that these health conditions pose, we recommend that these individuals contact their doctor to get the 3rd dose and to get an assessment as to their eligibility, particularly as we enter the fall. And over the weekend, the Ohio Department of Health released guidance on a subset of the population that is now eligible per FDA and CDC for boosters if they receive Pfizer for their first or second doses. Ramona Brazil, our co-director of Prevention and Wellness, will be up next to talk a bit about the details related to boosters. So on another note, We'd like to clear up some reports of misinformation regarding boosters, particularly for those people who may be seeking their first dose of vaccine. We've heard false reports that booster shots signal that the COVID vaccines are not working. Nothing could be farther from the truth. We need only to look at the significant drop in deaths that began this spring as more and more of us have gotten vaccinated. Boosters are a normal part of the cycle of several vaccines. In fact, we get a new flu shot, essentially a booster, every flu season. The shingles vaccine is like a booster for adults who had chickenpox, and tetanus also requires a booster. So this is part of the vaccine cycle, and it's important for people to understand that boosters help specifically in certain cases to offer an additional support for people that may be at risk, or sometimes over time when your immunity may wane over time. But the vaccine is incredibly effective. And again, we've had many, many less people die, and the vaccine has kept them out of the hospital and prevented fatalities. And the data is very clear on that. The evidence has consistently shown that COVID-19 vaccines are effective, and that as unvaccinated people are the ones that end up in the hospital or are dying at higher rates. So we want you to know the facts. Share them with your family and friends and encourage them to get their first shot if they haven't done it. Fall is upon us, and we all want things to be better than last year. Vaccine combined with indoor masking is the way. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms, and we are seeing a major increase in testing volume as we have with the emergence of the Delta variant. Currently, about 8.6% of residents tested in the county are positive, and that's up from 7.7% just a couple weeks ago. We advise parents, students, and faculty at schools and administrators to go to retail pharmacies to get tested, especially for asymptomatic exposed students and patients. Area libraries I've checked, and they're currently out of test kits and are awaiting additional shipments from the state when they're available, so stay in touch with the libraries. Area hospitals, and I'll repeat this again, I said this a couple weeks ago. Area hospitals have requested that if you are symptomatic and stable or need a confirmatory test, please go to the outpatient care centers or primary care offices for testing. Do not go to the emergency department for testing. It's important to keep our emergency rooms at the hospitals free to help those most in need. Please also remember that everyone with a known contact to someone with confirmed COVID-19 disease should get tested 3 to 5 days following exposure. It's important to isolate if you have tested positive for COVID-19 in the prior 10 days or are experiencing COVID-19 symptoms, and should also quarantine if you're exposed to someone who tested positive based on guidance from your local health department. These are proven public health interventions which are key to stopping the spread, along with vaccination and masking. On the data front, please go to our website if you'd like to see the latest data on COVID-19. We have a live dashboard there. If you click on the blue coronavirus banner, you'll see our data dashboard for more information, and we update every day at 2 o'clock or so. In closing, I want to take a moment to pay respects and honor all those who have died from COVID-19 in the United States. In memory of the staggering number of deaths we've experienced to date from the pandemic, an art installation entitled "In America, Remember" is currently on display on the National Mall in DC. White flags fill the National Mall, symbolizing the lives lost to COVID-19 in the United States, now approaching 700,000 souls. Each of the flags displayed across the 20 acres of grass holds a written, personalized message from loved ones honoring their memory. Untold suffering spans out in the countless ripples from this long and painful pandemic. We know that each of these individuals who died was someone special. Their sacred memory lives on in the hearts of their family and their friends. We have the power to bring this pandemic to an end if we all roll up our sleeves and we do the right thing. So please do that. Get that first dose if you've been waiting. We don't want another flag on the mall. We don't want another person we hear about that's died from COVID and the tragedy and the wake behind them. So I want to thank you for tuning in. We want you to get outside and enjoy the weather. It's wonderful weather. And of course, go Browns. And so with that, I'll turn things over to Ramona to provide information on boosters. Thank you.
Okay, thank you, Commissioner Allan. Today, I do want to talk with everyone to provide some clarity on booster doses. As you are aware, the CDC did approve booster doses last week, and we want to provide, I know that there's some confusion about who is eligible. So only those who receive Pfizer, who are at least 18 years old and older and received those doses, the last dose at least 6 months ago, are currently authorized to receive booster doses. So at this time, anyone who received Moderna or Johnson & Johnson are not authorized for booster doses yet. You shouldn't try and switch to Pfizer to try and get a booster dose. We may have more evidence later that says that booster doses are necessary for those who receive those other vaccines, but not yet. So this is only for people who receive Pfizer. So people who fit that criteria are encouraged to get the booster dose, especially if they're over the ages of 65, if they live in long-term care facilities. Also, if you have a variety of medical conditions, so even 18 and up, including cancer, diabetes, heart disease, current or former smokers. There's a long list of people who qualify based on medical conditions. And then also, if you are a provider or work in a high risk setting, like first responders and healthcare providers, if you work in education or corrections, like postal service, public transit, and also grocery stores. So the booster dose is actually the same formulation of the vaccine as it was before. It's the same dose that you received the first 2 times if you receive Pfizer. So the CDC is indicating that the side effects that could be expected with the booster dose would be similar to what you experienced after the second dose. So you know how you felt. A lot of people only had a sore arm. Some people may have felt tired, a headache, chills, muscle aches that usually only last about a day or 2. You can expect to experience the same similar kind of side effect after a booster dose. If you had some kind of reaction, and reactions are very rare, and you're concerned about that, and now you're eligible to get the booster dose and you don't know if you should or not, we recommend that you contact your healthcare provider to discuss that, and then they can often guide you on whether or not you should receive that booster dose at this time. When you do make a booster dose appointment and you go to have it, please take your vaccination card with you. Even if it's not your time yet to get the booster dose, please hold on to those vaccine cards. We've had lots of people lose those and then need it later for a variety of settings or to get additional doses. So please keep track of those cards. But as Commissioner Allan mentioned, overall, we want to reiterate that the COVID vaccines are working well. And while we're discussing booster doses, we don't want to lose sight of focus on increasing our overall vaccination rate. I've listened to people say why they haven't gotten vaccinated yet. And many times it's because of fear. Sometimes it's because of concern about effectiveness. And I understand, the perspective that people have, but we've seen to date over 390 million doses of the COVID vaccine being administered in the United States. And we've also seen complications be extremely rare and that long-term effects are highly unlikely. So I've also seen some people say, well, I think I had COVID before. Some got tested, some didn't. I've also seen people talk about wanting to focus on their natural immunity, but vaccination is still recommended. So even if you want to focus on taking vitamins, being healthy to help fight off COVID, you're still recommended to get vaccinated. You can do both. As well as if you've had COVID before, either you think you had it or you know you had it because you were tested, you're still recommended to get vaccinated after that because you still have the potential of getting COVID again. And there is some evidence that shows that your ability to be reinfected or get it again is higher if you only had COVID and not been vaccinated against it. So we are recommending that you get vaccinated. So while we have seen more mild and moderate cases of COVID with the Delta surge among vaccinated people, the evidence is clear, regardless of what kind of vaccine you got, whether it was Moderna, Pfizer, or Johnson & Johnson, that they are effective in reducing the risk of severe illness, hospitalization, and death compared to being unvaccinated. The CDC estimates that you're 17 times more likely to be hospitalized if you have not been vaccinated. So many of us at this point have known people who've gotten sick. Some of us know people who have died, but none have seen it at the same level as healthcare providers in the hospitals. And we have to listen to our medical providers right here in our community. As a nurse myself, I can say no healthcare provider chooses to work in a field to see people suffer and die when it can potentially be avoided. They've been up to this for over a year and a half. They are more than tired at this point. Many are traumatized. And our amazing healthcare systems are working to provide the most optimal care as possible. But we can help them by reducing the number of people who need higher level care. And the way we help them is through vaccination. If you haven't been vaccinated yet, please talk to people that you trust, who you know have been vaccinated before, ask their experience, talk to healthcare providers that you trust, and consider getting vaccinated. And with that, I'll turn it back over to Commissioner Allan for questions.
Thank you all for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So does anybody have any questions?
Hi, this is Anna Huntsman with IdeaStream Public Media. Can you all hear me?
Yes, thank you, Anna. Go ahead.
Oh, okay, great. Just wanted to make sure. Yeah, so I have a question regarding vaccinations. Obviously, Cuyahoga County has pretty decent vaccination rate, 54% fully vaccinated, one of the higher counties. But when you look at the city of Cleveland, only 39.2% of residents are vaccinated at this point. What do you think is causing that major disparity between the county's rate and the city's rate? And what are some of the efforts that are going on to try to get more citizens of Cleveland vaccinated?
Well, I can certainly start off on this. One of the things I would say is we're talking to Director Brian Kimball at the Cleveland Department of Public Health, is that they are out all the time. They're in rec centers. They're in mobile locations and churches, doing everything they can to make vaccine available in areas with the closer to home for people. So that's something they've been committed to, and they've been doing that for a long time. We certainly interact all the time, and all of us are doing everything we can to supplement community health centers and other sources for vaccination, pharmacies, et cetera. We know, I think Ramona described it very clearly, there's still maybe some fear out there, or folks that may have questions about the vaccine and its effectiveness. People read lots of things on the internet. And if you look around the state, you'll see there are varying levels of vaccination, not just within, closer geographic areas. It does vary quite a bit around the state. So there are a variety of reasons why people may be concerned, but I think efforts are being made where even through the Medicaid managed care agencies, where people are being offered incentives, $100 gift card or something to encourage them to come, or people hear about relatives that have been affected and hear that they went through vaccination, and then they're finding now that they've been through the vaccination their relative has, and they've been fine, and that those fears about vaccine, which now has been widely distributed around the world and shown to be effective, isn't so bad. I also think that the Delta surge is starting to encourage people to get vaccinated. They see that this thing spreads very quickly, and I think that is encouraging them to do so. But all we can do at this point, I think, is continue to offer those first and second doses, do what we can to dispel myths or concerns, encourage people to talk to folks who've gotten the vaccine, and you'll find that over across the board, people are staying out of the hospital, and they are or the fatality levels are not associated with vaccinated people to a very, very large degree. So this vaccine works, and all we can do is to continue to encourage folks and go to trusted sources like your health department or your doctor to make decisions about your health and about vaccination.
Thank
Thank
you.
you.
Thank you very much. All right. Thank you for your question. That concludes this week's briefing. Thank you very much for joining us, and we will see you in a few weeks. Have a great day.
Thanks.